In just a few days, if you do not have health insurance, you can begin to select a plan for coverage through the Affordable Care Act. But a word of caution as you are picking your plan. You may want to take a careful look at prescription coverage with each plan, or you could wind up paying quite a bit of money out of pocket. We have all the details in today's Medical Edge.
My dad is a retiree from IBM, and they just got notice in the mail that IBM is dropping their health care.
Jenny Jeffrey is just one of many family members in the next few days assisting those who need to pick a plan under the new Affordable Care Act. Those plans can be selected online and in a number of other ways, courtesy of what's called a health insurance marketplace. Most offer 4 levels of coverage: bronze, silver, gold, and platinum. It is suggested you consider a person's health history to see which is a better choice, especially when it comes to coverage for prescription medications.
With my dad being a heart patient, mom being a cancer patient, I'm a little concerned as to what their coverage is going to be.
She should be concerned, according to Dr. Carl Shapiro. He's a specialist in physical medicine, rehabilitation, and pain management.
So your biggest concern as a person who provides a fair amount of care with a number of therapies, including medications, is what?
There'll be restricted pharmacies and restricted access.
That access is a concern. At least one analysis in this online publication, Healthcare Payer News, found those who choose lower cost plans in the bronze or silver levels will likely pay more for prescription drugs than they do now, in some cases up to 34% more. It suggests you check to make sure a particular medication you need is included in your drug benefit under the plan level you choose, especially if it's a newer medicine or it's expensive.
The perception is I'm going to have universal coverage, so I'm going to walk in and everything's going to be covered. I'm going to hand them this prescription and they're going to give me everything. That's the perception.
No, you have much less coverage.
Okay.
Much less. Much less. And you have much less control over it.
This may be an even bigger problem for those who can't afford medication. Rosanna Eit of Faith Community Pharmacies says a lower cost plan is likely to have a higher deductible, which means
that might have prescription coverage through the mandate, but they can't afford it.
In other words,
there might be a huge deductible that they'll never meet, but by law they'll have to have this coverage. So now they can go to the doctor and yay, they'll get prescriptions, but they may not be able to afford them because they've got a $2,000 out-of-pocket prescription deductible.
Liz Zink Pearson is a health law attorney who teaches at Chase College of Law. She says, for example, at the bronze level,
it's the coverage at bare minimum level, 60% coverage. There'll still be 40% out-of-pocket cost.
Picking up 40% of a cost can be substantial, so you may want to consider prescription coverage when you consider the total cost of the healthcare plan you choose. So here is what's suggested on the sites with the healthcare marketplace. It allows you to put in some information about a person's current health status to see which plan meets your needs for prescriptions or other care. We do have a link for you. Just go to local12.com and click on the Get It button.